Welcome to all of you that have joined us for the DuPage County Coroner Candidate Forum, and to the candidates, Richard Jorgenson and Judith Lukas. The League's purpose is to promote civic responsibility through the informed and active participation of citizens in government and civic discourse. A forum is not a debate. Voters will base their decisions when casting their ballot on what a candidate will specifically do if elected to office, not what their opponent won't or didn't do. So all candidates this evening have agreed to abide by the ground rules established by the forum. These rules specify the format, time limits, broadcasting of the forum, and other rules related to the conduct of the forum. The candidates will begin in alphabetical order with their 2-minute opening statements. They will then alternate the order in which they answer questions for 2 minutes each. After the question portion of the forum, each candidate will give a 2-minute closing statement, continuing our alternating pattern. A member of the League will be acting as timer and will enforce the time limits. Candidates, you will see a slide or a paddle up there to let you know that you have 30 seconds, 15 seconds, and then stop. Should a candidate exceed the time limit, I will ask them to finish their sentence and move to the next candidate. To ensure that questions for this evening's forum represents a balance of topics, a panel of experienced members of the League of Women Voters will review the questions submitted for appropriateness and to avoid duplication. And finally, I want to say how appreciative we are of the candidates who are not only willing to serve in office, but who have agreed to be here this evening to share their ideas and their goals. So let us get started. Candidate Jorgenson, you have 2 minutes for your opening statement.
Thank you, and I'd like to thank the League for doing this most important job, which is to educate the voters as to the candidates that are on the ballot. My name is Richard Jorgenson. I've been your coroner for the last 12 years. I've lived in DuPage County my entire life. I grew up in Lombard and moved all the way to Wheaton. And my previous job was I was a trauma and vascular surgeon at Central DuPage Hospital for 20 years and had to retire, or actually I'm disabled because of severe allergies to chemicals and fabrics in the operating room. During my time as a surgeon, I took care of over 40,000 patients and operated on over 10,000 people in the community. After I couldn't practice anymore, the coroner was retiring, and I wanted to use the experiences that I had in trauma surgery and in surgery to better use, and ran for the office of coroner, was elected first in 2012 and re-elected since that time. During that time in office, I have supervised over 70,000 forensic investigations, sadly presided over 1,100 overdose deaths, 1,100 suicide deaths, and over 150 homicides. I am completely revamped and reorganized the office to be more efficient. When I first started, there were 4,500 cases that we reviewed. This last year, we reviewed 6,800 cases. We have the same head count, and we have taken care of that increased workload by doing the job better with less. I want to continue to do that. I want to continue to work on my proactive job in trying to prevent and diminish suicides and overdose deaths. Thank you.
Thank you. Candidate Lukas, your opening statement, please.
Yes, hello, I'm Judith Lukas. I'm a registered nurse. I'm also a lifelong resident of DuPage County. I grew up in Lombard. We both went to the same high school, Glenbard East. So not sure what that's saying, but go Rams. The chair of our party asked me about 4 years ago to consider running for coroner, and at that time, I don't believe someone should run for office unless they have a reason. So I really thought at that time, no, it wasn't the proper time. But I've thought about it in the 4 years, and in my family, we had some tragedies, both before and after that, the 4 years. I've lost 2 nephews to suicide, and I've lost 1 nephew to substance use. And as a nurse, I can only do so much. I can only reach a limited number of people in my community. And, whenever there's a tragedy born, that's when people will write a book or they will start a movement, Mothers Against Drunk Driving. So I thought, how can I help people? I want to prevent so many of these preventable, needless deaths. And that's when a light bulb went off, and I thought, wow, if I'm coroner, I can reach 1 million people in DuPage County. So that is why I am running. I'm very big on education. I'm in the nursing, code of ethics. It's, we're working towards the health of our community. So I'm teaching, I'm developing a program to teach middle school and high school coping skills because, we've looked at the Just Say No program, the DARE program. People remember the egg in the frying pan, but it really hasn't been effective. And I thought, we need to do something different to get better results. And that's why I'm instituting this program. I also want to have a forensic lab at the county level. We have so many, whoops, my time's up. Thank you.
Thank you very much. So, Candidate Lukas, I will start with you for the first question. What qualifications, training, or experience do you have that make you the best candidate for county coroner?
I'm a registered nurse, and nurses are scientists. I have a bachelor's degree. I got my associate's degree in nursing at College DuPage, went on to my bachelor's in Purdue. So if anyone knows about BSN, those 2 years is really, you're focused on research-based. So I have a strong research background. The Will County coroner is a registered nurse. Kane County, I don't believe it's this one, but a previous one, they had a registered nurse, so nurses can do it. We are ultimately scientists. We are research. Everything that we do is evidence-based, and I know in this department, we will need an evidence-based, oh, I didn't miss the paddle. We need an evidence-based answer. So with that, other part of nursing, in addition to examination and, or I should say assessment and following, carrying out the doctor's orders, we have a really large component of education. So that's where I'm, going on my education and all of everything. We don't do anything unless it's evidence-based, and that's what we need. The coroner does not perform autopsies. That's done by a forensic pathologist in the office. The coroner is the manager. I've had a lot of management experience before I was a nurse. I worked at the Postal Service for 26 years. I have a lot of things with government contracts and forecasting and human resources and timekeeping management. So I've got that strong background. I was a union steward for a while. I'm very active currently with the National Nurses United, and I was a member of the AFSCME. So I have a really strong union background, and I'm the bridge. Not only would I have a strong management background, but I'm also could be a bridge between the employees and the manager. Thank you.
Candidate Jorgenson, the same question, please.
Could you repeat the question again?
Sure, I can.
Yes.
What qualifications, training, or experience do you have that make you the best candidate for county coroner?
Thank you. Yeah, before I became the coroner, I first of all am a surgeon. I've been in training for my medical degree and my surgical training until I was actually 31. So we do quite a bit of training and experience before we even can go out and practice. And then I practiced for 20 years. I started my solo surgical practice here in Wheaton and grew that into a 9-surgeon and 25-employee practice with an over $6 million revenue. It was a very, very successful practice at both CDA DuPage and Edward. So I come with a large administrative skill from that experience. When I came to the coroner's office, the most important point about the coroner's office is we investigate sudden and suspicious deaths, the most important of which is homicides. I've supervised over 150 homicide investigations. It is critical to know how to do a forensic legal investigation. I have, as I said, I've been very experienced in doing that, and will continue to bring that experience with that. If you come to this office without that experience, for example, we had a very high-profile homicide a couple of weeks ago, and if that investigation is not done properly and all of the evidence gathered in the proper way and treated according to legal standards, all of that may be thrown out and a murder may walk free. So it is critical that somebody that knows how to do this job and how to take care of the public good is doing this job, and I have that experience.
Thank you. Candidate Jorgenson, the second question is, what do you believe poses the greatest challenge to the coroner's position in the coming years?
I think that under my leadership, and this is always very hard to say, it's very hard to compliment yourself or talk about yourself, but I've worked for 12 years to build this office into the office that it is. When I came in, we had no certified death investigators. We had no one with continuing medical education. We had no educational budget. We did not follow national standards. I've initiated all of that. I wrote an entire policy manual and procedure manual that adheres to the Department of Justice mandates and how they want death investigation to be done. I've also upgraded the entire office in capital budgets, bought new cars for the safety of our deputies. So at this point, the county board has provides us through my management of this and bringing proper budgets to the county board to be passed, we have adequate funding for our office, and I'm very proud of our county board for giving us that. The problem that I see is going forward and why I want to be reelected is to continue that path and to continue the proper guidance to be able to bring a budget to the county board and get it passed, which we just did, is a skill. And you have to be able to talk to the county board, and right now we have a bipartisan county board, and we have to get that passed. So the most important thing that I see going forward is continuing the quality of the coroner's office in the way it is right now. Candidate
Lukas.
Yes, I'm also a certified legal nurse consultant. I have a certificate in that with some extra education. And what that means is I forensically can go into charts and I look at everything, the things that were done, orders, if they were carried out, what was right and what was not. So I can advise an attorney how, if this case is, was there malpractice in here, et cetera. So I do have a very strong legal forensic background. My opponent talked about communication with the board. Well, I've talked to a number of county board members who are not happy with the coroner's office because we've had 3 people in recent history that have died at DuPage County Jail. And the coroner's office did not notify the board members. They were very upset. So that's one thing that I'm going to do. If there's a death in law enforcement anywhere in the county, I'm going to do a press release. I've been getting emails from the county for a few years. There's press releases if a pedestrian's hit by a train, if a body is found somewhere, but not if there's a death in custody. So anytime there's a death in police custody anywhere in the county, that will be going out in a press release. If it's a death that's happened in the jail, I will notify the county board, as I think that I would be ethically and morally obligated to do. So that's a very big, mistake, I think, about what's currently happening. The other thing is I've talked to employees that are currently deputy coroners. There are things that they are not happy about. The starting wage is very low. And we need to, have a work-life balance with the pay too.
Okay.
Are we allowed to just throw
No.
slings out? You asked for decorum.
No.
Are you just allowed to throw things out like
I'm
that without response?
I'm sorry, no, that's not how the forum works.
Thank you.
Okay.
Thank you. Because I would be happy to respond to all those, because everything she just said is not true.
Okay.
And I would be honored to have
All
the
right.
time to respond to it, or just not respond to it. and go
Candidate
to
Jorgenson, we need to move
television
on.
questions.
Thank you. Candidate Lukas, the coroner often deals with cases involving sudden, unexplained, or violent deaths. What are the most important skills for a coroner to possess that would ensure such cases are handled with both professionalism and sensitivity?
Right. As a registered nurse, I've been dealing with end-of-life issues my entire career. So as far as sensitivity, confidentiality, patients' rights, families' rights, that's in my DNA. If you're a nurse, you know what sterile technique is, right? So, that's just the same thing in a crime scene. You don't like walk all over the crime scene. You don't let unauthorized people in. Everything has to be preserved, because every death is considered a homicide until proven otherwise. We're not going to assume that there was a suicide. So with my background, with my sterile technique, that and my preserving a crime scene and my sensitivity with dealing with families, I have a very, because I worked in the post office for 26 years, everything, and in healthcare, everything is regulated by government regulations. We had to, certain books we could only write in a black ink and not a blue ink. This is pre-computers. So I'm very meticulous in following every single letter of the law, every single procedure to make sure that crime scene or potential crime scene is preserved. I also believe in the deputy coroners and the other first responders going to a scene. It could be quite traumatic for people. And so we need to address that area as well, as far as aftercare for the first responders. Currently, I think the coroner's office needs to be improved as far as putting resources on their webpage for families that have gone through traumatic losses, for them to reach out and to be able to get the services as well.
Mr. Jorgenson, same question. What are the most important skills for a coroner to possess that would ensure such cases are handled both professionally and with sensitivity?
Yeah. Once again, can I ask her, do I get to have time to respond to accusations?
I'm sorry.
Okay.
If you want to forego
Okay.
answering the question I
I'd
posed,
just like to
which
have a
I hope
civil
you
debate,
don't. Yeah.
or civil discussion.
This is not a debate, so we need to move on.
Okay.
Thank you.
The most important, could you ask a question?
Sure. With regard to sudden, unexplained, or violent deaths, what is the most important skill for a coroner to possess?
Okay. The most important skill, first of all, is to have the knowledge and experience of of forensics and the legal aspects of a crime scene. Every single case we go out on is considered to be a homicide until it's not a homicide. So we have to go to every scene, very dispassionate, very pulled back, and because the person that we're talking to, who sadly may be showing great remorse or sadness or being crying, may be the person who just killed his wife. And so we've had that happen many times. So the most important thing is to have that ability to be dispassionate and to go out and examine the crime scene without any prejudice against or for people, and to then examine that scene. Once the scene is considered to be a crime scene, the knowledge and experience of how to take care of a crime scene and work with the sheriff's office and their crime lab and their forensics lab is essential as well, because we work together with the 34, 35 jurisdictions within DuPage County and work together to make sure that we process the scene so that when that evidence is brought to court, that it is admissible and that the person who committed the crime is found guilty. Thank you.
Thank you. Okay, Mr. Jorgenson, the opioid crisis has led to an increase in drug-related deaths across the country. How would you work, or how do you work with local law enforcement and public health agencies to address the rise in opioid-related deaths in our county?
Thank you. When I became coroner in 2012, I was shocked with the number of opioid deaths. In the summer of 2013, the first summer that I was coroner, starting with the 4th of July, we had an overdose death every day for the month of July, 18 straight deaths. It shocked me to the point that I went back and reevaluated and looked up every case of overdose deaths that year. And we had 38 deaths that year. And I started talking, I talked to the county board, and I talked to local schools at such, and with Darlene Rossetti, the regional superintendent of schools, we had a meeting that summer with every superintendent and every principal of DuPage County schools to try to open this issue up and talk about it. But we had 38 deaths that year. It has increased every year since then, with the exception of last year. Now, the important thing is that rather than just document that, I went out and we had meetings at high schools, junior high schools. We had community meetings, town halls, and tried to educate the public and bring this to awareness. One of the programs I'm the most proud of is that as a physician, I'm able to sign prescriptions. And one of the police chiefs came to me and said, people are dying and we're going to houses and people are overdosing. We can't do anything about it. So, well, let's get them Narcan or naloxone, which is the opioid antidote. And I can write prescriptions since I'm a prescriber. And we started this program called the DuPage Narcan Project. And within a year, every department in DuPage County, every police officer carried naloxone in their go bag, and to date, we have 7,000 people trained in this program, and we've saved over 2,000 lives due to this program. Thank you.
Candidate Lukas, your answer, please.
Yeah, can you?
Sure. The opioid crisis has led to an increase in drug-related deaths across the country. How would you work with local law enforcement and public health agencies to address the rise in opioid-related deaths?
I do commend my opponent for starting the Narcan program. I think it was about 11 years ago that he wrote the prescription, which is great. We need to do more. So like I said, the programs that we've done, the Just Say No, the DARE, they are not effective. And so the definition of insanity is doing the same thing every single time and expecting different results. And that's why I want to educate the community. If it's up to me, I'd educate everyone. But I want to start with our middle and high school students. I'm developing a program. I will have med students, nursing students in the psychology field will be implementing this program. I a lot of people don't know what the coroner's office does. I want to, with my public health background, bring this office into the public, attend events, be at fairs, and let people know what we do. There is a suicide hotline number. Show of hands, who knows what the suicide hotline number is? Okay, we got 2 people in this whole room. It's 988. I want to make sure everybody knows that. I want to have a QR code out everywhere. I've had people say, well, I don't need that. You don't know when you're going to run across someone who does. So there's so much public outreach that needs to be done. The coroner's office every year will report death statistics, number of deaths from substance use, number of deaths from suicide. To me, that's almost a little offensive, because people are not statistics. These are lives, these are souls, these are family members. When we do lose someone from either substance use or suicide, that not only is that one person, that affects that whole family, sometimes for generations to come, and friends. So we need to do more to get that out there in prevention. Thank you.
Thank you. Candidate Lukas, the coroner's office plays a key role in tracking public health data, such as deaths related to infectious diseases or environmental hazards. How would you collaborate with public health agencies to address these issues?
Great. That's a great question. Yeah, we've got both the DuPage County Health Department, and we have all of our hospitals. And when in my nursing, besides working in the hospital, I also did home health for 8 years. And medicine changes daily, okay? And regulations change daily. So it was up to us to report if someone had a UTI. If someone has a UTI within 30 days after hospital discharge, and they have to be rehospitalized, Medicare doesn't pay for that. So there's so much education. And if there's a weak chain anywhere, like if there was a nurse who did not report something with one of their patients, that information is lost. So, and I do know nurses are overworked, both in the hospital, home health, and sometimes you just don't have time to do that. So I think it's important that we get every single practitioner to report what needs to be done. Then it goes on up to the hospitals. There are mandatory reporters, and the health department. I think that's going to take a really big effort from everyone on all levels, because that's really, truly the way we can assess the health of our community, with accurate reporting. Otherwise, the information, it's not accurate, and it's not going to, I worked at the DuPage County Care Center, and that was also another thing that was really important, because at that point, if you had somebody with COVID or flu or something, then they would actually, kind of cordon off that, where nobody could come onto the unit unless they belonged there and no one could leave. So it takes every single link in the chain to be able to do that. And I think that's what we need to do, is let every practitioner know how important it is to follow through on that.
Okay, thank you.
Thank you.
Candidate Jorgenson, the same question. Playing a key role in tracking public health data, how would you collaborate with public health agencies to address these issues as they relate to deaths and infectious diseases and environmental hazards?
Right. The thing at the end, but I would just say that the role of the DuPage County Coroner, which is the authorities and laws come from the state of Illinois and the General Assembly, do not include the jobs that my opponent just talked about. Those are all jobs of your public health department, which in DuPage County is amazing. And I can tell you that the job that they did during COVID was absolutely spectacular. But it's the job of the DuPage County Health Department to track public diseases and public health illnesses. It is our job to to investigate, as you asked in your previous question, sudden deaths, suspicious deaths, those type of things. We are not charged with identifying, tracking, or evaluating public health illnesses and or diseases. Interestingly, Cook County is, because they are a medical examiner system, and they get their rules from ordinances from the county board. So they had a very different job during COVID than we did. But we do not do that other than if a person dies, it is our job to identify what that disease was and work with the health department, which we do on a daily basis. We work with them pretty much on speed dial. But we are not the people who do any of what my opponent just said. We do not track communicable diseases. We do not track health illnesses. We do not monitor hospitals. We do not do any of those things. That is not in the legal job of the DuPage County Coroner's Office.
Okay, thank you. So that was actually our last question. Time is going fast. It's now time for closing statements. I will just mention that if you would like to address any discrepancies, this would be the time to possibly do that. It's your choice. But I'll start with you, Candidate Jorgenson. You have 2 minutes for your closing statement.
Well, I would like to close on a high note and keep this discussion on a high note and not respond to any of the salacious comments that my opponent has thrown out here. I think it's very clear that I've dedicated the last 12 years of my life to this office for the public good. I've been a leader even in the nation in regards to opioid and suicide awareness and trying to diminish those numbers and to take care of those families. One of the other things I'm the proudest of is I was one of the first coroners in the state to have a wellness program. We have a chaplain, psychologist / mentor that comes in on a regular basis. He's a member of our team to take care of both the public and our workers. So it's very important to me to have a quality office with healthy people and healthy workers out there taking care of the public of DuPage County. I'm proud of my work, and I hope that what all of you do, and I thank again the League for doing this, is by bringing out getting the ability for us to talk about our qualifications and such is a great service to the voters. Thank you very much.
Thank you. Candidate Lukas?
Yes, thank you. Yes, I also want to thank the League for having us tonight in this forum. My answers are my truth. I did not say anything about my opponent. I'm telling you, my whole objection here is to let you know who I am, what I stand for, and what I hope to accomplish in office. My answers are about me. I'm not sure really why my opponent's getting offended, but that's neither here nor there. So again, you know, my idea, my opponent's doing a fine job. I've never said one bad thing about him, but I think what we need is more than fine, okay? I want to do more than a fine job. I want to educate our youth. I want to teach people coping skills. I want to have everybody have that 988 number in it. I want to be at public events. I want to bring more. The other thing we didn't really touch much on is the forensic lab. Kane County has gotten nearly $1 million grant, a federal grant for a forensic lab. We have rape cases that are sitting on shelves. They're not necessarily, I'm not saying they're attached to a death investigation, but we've had them on shelves in police stations all over the state for years. we can't do that. You know, what we need to do is I want to do a forensic lab, because not only do I want to bring justice to the victims of any kind of a sexual assault or a violent crime, the perpetrators of those crimes quite often go on to do it again. So I also want to prevent that from happening. So with the coroner's office, you know, thank you. That's one of my other goals that I hope to accomplish. And thank you for your time.
Thank you, both of you. On behalf of the community, thank you for being with us this evening. Also, thank you to the City of Wheaton Communications team for their assistance. Our democracy thrives when all of us are engaged. Attending or watching a candidate forum is an excellent way to be empowered to join discussions on local issues and make your voice heard on Election Day. We hope that each and every one of you will vote and inspire your family, friends, and neighbors to do the same. A recording of this forum will be posted on the League of Women Voters of Wheaton YouTube channel and website, and also on the websites of the DuPage County Leagues. So thank you very much tonight. We appreciate you being here.